Aboutomania, a mental disorder characterized by pathological indecisiveness, is not included in the DSM-5-TR. It is defined by an individual's profound difficulty or inability to make choices in their daily life. This condition significantly impairs social functioning, making it challenging to maintain personal and familial relationships. This case report aims to explore the nature of aboutomania and its connection to other mental illnesses. The aim of the WISE is not to secure pleasure, but to avoid pain. Grief can be the garden of compassion. If you keep your heart open through everything, your pain can become your greatest ally in your life, searching for love, cure and wisdom. Remember, the world is here for you. On the channel biography there's an email address. You can write and share the world your pain anonymously. Aboutomania, from Greek a without, and bowel will, is a mental disorder in which the patient displays pathological indecisiveness. The term was created in 1883 by the neurologist William Alexander Hammond, who defined it as a form of insanity characterized by an inertness, torpor, or paralysis of the will. It is typically associated with anxiety, stress, depression, and mental anguish, severely affecting one's ability to function socially. In extreme cases, difficulties arising from the disorder can lead to suicide. Although many people are indecisive at times, it is rarely to the extent of obsession. The part of the brain that is tied to making rational choices, the prefrontal cortex, can hold several pieces of information at any given time. This may quickly overwhelm somebody when trying to make decisions, regardless of the importance of that decision. They may come up with reasons that their decisions will turn out badly, causing them to overanalyze every situation critically. In a classic case of paralysis by analysis, lack of information, valuation difficulty, and outcome uncertainty can become an obsession for those with aboutomania. Although it is a recognized and diagnosable mental disorder, aboutomania is not recognized by the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Aboutomania is characterized by great indecision and an inability to or difficulty in making any kind of choice in a person's daily life. This significantly affects functioning, specifically the ability to function socially, making it difficult to maintain family and personal relationships. There is a significant overlap between the symptoms of aboutomania and obsessive-compulsive disorder (OCD), with pathological doubt and significant impairment in decision-making being prevalent across both conditions. Many OCD patients can be considered to have a form of pathological indecision, which is also displayed in aboutomania patients. Some aboutomania symptoms are: 1. Lack of self-confidence. 2. Avoiding spending time alone. 3. High levels of uncertainty and anxiety. 4. Anticipatory anxiety regarding decisions, usually leading to mental blocks. 5. Avoiding personal responsibility, for example making decisions. 6. Decision-making process takes a long time. 7. Decision-making process is extremely difficult. 8. Difficulty functioning independently or making decisions without support from others. 9. Overanalysis of situations. 10. Dysfunctional post-decision behavior, for example worry, reassessing of decisions. 11. Obsessing over inability to make decisions. Some level of indecision exists within normal psychopathology, and it has been found that having extensive choice is demotivating to consumers in supermarkets, who prefer limited choice contexts. However, this indecision is rarely to the extent of obsession. According to the DSM-IV definition, when symptoms become clinically significant and associated with distress and impairment to the functioning of the individual, they can be considered part of a mental disorder. When the symptoms are relating to indecision, this disorder may be a bowlomania. It has also been found that indecision is a common characteristic in mental disorders like depression, and is associated with OCD tendencies, conditions both associated with a bowlomania. Diagnosis and treatment. For the diagnosis of a bowlomania, a mental professional must initially eliminate physical illness or neurological damage as an explanation for the patient's symptoms. To do this, the medical professional must perform physical examinations and a complete medical history. Then the patient can be referred to a psychiatrist who assesses the prevalence of a bowlomania using a clinical interview relating to their symptoms. There are currently no laboratories tests to diagnose a bowlomania specifically, but there are assessment tools available to psychiatrists to aid in the evaluation of a bowlomania. 1. The Minnesota Multiphasic Personality Inventory, MMPI. 2. The Mellon Clinical Multi-Axel Inventory 4th edition MCMI-IV. 3. The Rorschach Psychodiagnostic Test. 4. The Thematic Apperception Test, TAT. Psychotherapy is the preferred method for treating a bowlomania, to reduce the adverse effects of patient symptoms, which may be similar to those of people suffering from OCD, anxiety or depression. Therapy can be used to help the patient become more independent. One method for this may be assertiveness training to help develop self-confidence. Medication can also be used to treat patients with a bowlomania if it is comorbid with other mental disorders, such as depression or anxiety. You can't go through life allowing pain to dictate how you behave. I met someone who wanted to share the world her pain. Hear from her.
Hi, my name is Amelia. I'm a therapist. In this direction I'm gonna talk about indecisiveness. Indecisiveness is a condition or quality of being unable to decide, conclude, or resolve something. Indecisiveness can be a symptom of mental health conditions. In fact, indecisiveness is a prevalent symptom of major depressive disorder. Indecisiveness has many causes, but you can get better at making decisions, big and small, with practice and time. Whether it's a major decision, such as choosing a life partner, or a minor decision, such as what to eat for breakfast, being indecisive can significantly impact your life. Difficulty in making decisions can be caused by several factors, such as a fear of failure and a lack of confidence or information. Indecisiveness can also be a symptom of mental health conditions, such as attention deficit hyperactivity disorder, ADHD, depression, and post-traumatic stress disorder, PTSD. If you experience indecisiveness and making decisions is a constant source of stress and anxiety, you're not alone. There are effective methods that can help with decision making. What causes indecisiveness? There are many situations that may cause indecisiveness. Here are a few. 1. Fear of failure. Some people are inherently more hesitant when it comes to making decisions. Indecisiveness certainly can be a learned behavior. Those raised in environments where decision-making is seen as an opportunity to learn and grow tend to feel more comfortable making choices. If, however, decision-making becomes associated with making errors or bad choices, indecisiveness often results. For example, if a parent criticizes a child for making a poor decision, the child will avoid making decisions for fear of being seen as a failure. These fears can carry over into adulthood and lead to the use of indecisiveness as an unconscious coping strategy, Manley explains. Over time, The stress and anxiety associated with making decisions leads to an avoidance of making both small and large decisions. In this paradigm, decision-making can have a negative impact on self-worth. A good decision increases self-worth, and a bad decision leads to self-criticism, Manley says. In many cases, the fear and anxiety evoked at the mere thought of having to make a decision can be quite paralyzing. This perpetuates the tendency to default to the relative safety of indecision. 2. Parental influence. The root of your indecision may go back to parental influence. If someone has grown up with overbearing parents, they may not have had an opportunity to make decisions independently. There was never any chance for the person to fail or succeed by themselves. As such, once they're given the opportunity to make a choice, they're left looking for someone else to make that choice for them. 3. You're a perfectionist. Perfectionism can lead to numerous health problems, including anxiety, depressions, and burnout. When someone constantly sees their options categorized as right and wrong, they may find themselves paralyzed at the thought of accidentally choosing a wrong decision. This leads to a constant back and forth as they struggle to figure out the correct choice. 4. You're a people pleaser. Do you constantly worry about what others think? If you're a people pleaser, you may find yourself continuously struggling internally between choice A, what you want, and choice B, what others want. 5. You've lost sight of the bigger picture. This goes back to focusing on what matters. Many people get lost in the details and can become overwhelmed. Most people strive for some kind of goal, whether professionally, spiritually, or mentally. However, when one begins to lose sight of these goals, they often start to lose sight of how they'll get to the goals as well, leaving them feeling lost and confused when it comes time to decide which direction they should take. 6. You lack confidence. Self-confidence is a key component of decision-making. Perhaps someone does know which direction they should move toward to achieve their goals. Yet if they're insecure, they may be able to choose the decision that's right for them but struggle with sticking to it. Self-doubt and a lack of confidence could even mean they procrastinate. 7. You lack proper knowledge of the subject. This is less internal and more due to circumstances. Some people may have the confidence and skills to make solid decisions promptly. If this is the case, the problem could lie in the fact that a person simply does not have enough information on the subject they need to decide on. 8. You have aboutomania. This is a diagnosable mental disorder. Aboutomania is when a person shows signs of pathological indecisiveness. While most people will be indecisive at some point, people with aboutomania are indecisive to the point where it is an obsession and severely affects their daily lives. 9. A symptom of other mental health conditions. Indecisiveness can be a symptom of mental health conditions. In fact, indecisiveness is a prevalent symptom of major depressive disorder. People with ADHD also experience difficulty making decisions due to factors such as inattention, memory problems, and distractibility. Other mental health conditions in which indecisiveness can be a symptom are anxiety, dependent personality disorder, stress trusted source, childhood trauma, Alzheimer's disease. 10 methods that can help you become more decisive. 1. Make decisions for yourself. Asking 10 people about one topic will only confuse you further. Ultimately, if you trust your intuition, you will know what the right decision is. Nobody can give you the correct answers on what's best for you besides yourself. Try not to allow others to be the decider between you and your goals. 2. Develop your confidence. When you make a choice, trust your intuition that it's the right decision for yourself. Avoid second guessing. If you have the confidence to trust yourself, you'll find making and sticking to decisions much easier. 3. Let things go. The fear that comes with worrying about making the wrong decisions can be paralyzing. Try not to worry about mistakes, they're a part of life. Once you accept that things are not always in your control, making decisions will be much less threatening. 4. Flip a coin. Of course, this method shouldn't be used for big decisions, such as marriage. But this will work if it's something as simple as what to order on the menu. This simple trick, which I use often, makes the decision for you, Manly says. And there are times when your gut knows what it truly wants when the coin lands the wrong way. What's interesting about flipping a coin is that your reaction will actually reveal what you truly want. 5. Narrow it down. If you're facing a variety of options, take a practical approach. Narrow down your selections to 3 options with a surgical slice. Don't question yourself. Then evaluate the final 3 options and pick one. 6. Choose one person that can act as a sounding board. There will be instances when you're truly stumped. When feeling stuck, ask a supportive friend or partner to weigh in, Manly says. 7. Outline the pros and cons. If you get stuck, draft a simple pro-con list. But the important thing to remember is to write it down. Mentally weighing the pros and cons is simply adding to the indecisiveness. Pro-con lists facilitate objective and sound decision-making. 8. Talk it out. The simple act of speaking out loud will help alleviate indecision and internal conflict. If it feels right, voice your thoughts out loud to a friend or partner. Decisions can become less confusing and worrisome when we voice our fears and choices out loud. 9. Avoid questioning your final decision. Once you've made the decision, avoid second-guessing yourself. Simply embrace your selection and move forward. 10. Recognize and celebrate your decisions. Congratulate yourself for every decision you make. Practice a kind, validating affirmation. For example, you might say, "I made a great decision. I'm getting better at making choices. This feels good." If a negative voice tries to step in to create self-doubt, simply repeat your kind, validating words. Making decisions big and small can sometimes be difficult. We've all experienced indecisiveness. In fact, I was once a patient. It was a long journey to heal, but I did it. So can you. Never give up. Indecisiveness can be caused by several factors, from a fear of failure and lack of information, to conditions such as bowelomania, depression, and ADHD. But there are steps you can take to get better at making decisions. If you feel that indecisiveness is affecting your daily life, consider talking with a doctor or mental health professional. Goodbye.
Risk factors of bowelomania. The underlying causes of bowelomania have not been empirically proven. The factors contributing towards the development of bowelomania are likely a combination of both environmental factors, taking place during development, and biological factors. It's so hard to forget pain, but it's even harder to remember sweetness. We have no scar to show for happiness. We learned so little from peace. Thanks for watching. Don't forget to like and subscribe. Catch you later.